We're looking forward to more great presentations today. Once again, we would like to acknowledge and thank our speakers and sponsors. Obviously, our retreats would not be possible without them, but even more so, their support is absolutely essential for our other programs and statewide efforts to bring cancer services and resources to so many individuals who may not know about or have access to these resources. And we would like to thank our sponsors and donors from the bottom of our hearts. Part of what makes this retreat and many of our other programs possible is the support we receive from participants just like you who have attended a retreat. If you are enjoying this program and you want to get more involved with our organization, there are several ways that you can do so. You can attend a live retreat. We hope that we can start offering our in-person retreats again next year. We're already in the planning stages of that. We certainly look forward to that time and invite you to join us in experiencing the fun and excitement of that live retreat. Word of mouth is our best resource. Tell other people you know who are coping with cancer about our organization and our programs and services. Be sure to complete the evaluation polls at the end of each of our sessions and the post-program survey as well. You'll receive that via email after the program. It will only take a few minutes and the feedback will be extremely helpful to us as we use that to tweak our programs in the future. Send us emails or letters telling us how the program has impacted you. These stories always have a huge impact for our sponsors, and we do share them with our sponsors. Become a volunteer. Many of our volunteers attended past retreats and as a patient or a family caregiver. There are many opportunities to volunteer for our organization, and it's a great way to pay it forward. And finally, consider making a donation. More information on donating can be found on our website at cancerservicesnm.org. And the topic this morning is Healing Bridges, Integrative Medicine, Oncology. Dr. Pierce, please introduce yourself and the panelists as well. Thank you.
Good morning, everyone. Glad to be here. My name is Dr. Surya Pierce, and I'm originally from a small town in Minnesota, trained at the University of Wisconsin for medical school and residency, and have been here on faculty at UNM for the last 6 years, both in the departments of internal medicine and now departments of family and community medicine. I'm really looking forward to connecting today. Please also allow me to pass the mic, if you will, to Dr. Shellhoff, who can introduce herself.
Yes, hello, my name is Laura Shellhoff, and I'm a doctor of Oriental medicine. I've been practicing since the year 2000. I've lived in Albuquerque since '95, was raised in Ohio and Washington, D.C., did some college in Israel and Washington State, and slowly made my way to becoming a doctor of Oriental medicine. Nice to meet you. I'm happy to be here, and thank you for.
Well, I'm going to go ahead because I'm glad to be here with you all again. This is my 6th year presenting at Cancer Services of New Mexico, and I really appreciate the opportunity every time. My name's David Lang, and I'm a licensed massage therapist, certified oncology therapist here in the United States. And I have been practicing, this is my 30th year of practice. I work with children and adults who are thriving through cancer. I just retired from the University of New Mexico Center for Life a week ago, and I'm on my own now in my own private practice, and I'm looking forward for this presentation today and hoping to see you in the near future. Thank you.
Great. And yeah, Dr. Shellhoff, David, and I have all participated in this retreat on numerous occasions in the past. So it's always a little bit awkward on Zoom, I think, as we're all aware, but really glad to be with you here today. We have a great presentation. Hopefully it'll be fun. I know that it's interesting, And let me just now share my screen. So the title of our talk is Healing Bridges, Integrative Medicine, Oncology, and Complementary Therapies. Here are our names and kind of our affiliations. In the past, I know that our slides have been made available to all the participants, and I assume that that will be true again. I know that some of you are certainly taking notes, but do remember that if you see a slide that has information that you want to come back to, you should be able to access it. If there's not a mechanism for doing that on the website for Cancer Services of New Mexico, feel free to contact me or any of the presenters here. We're happy to share our information and hopefully share some of our own journeys of healing. If we could just take a brief moment for a mindful pause. I want to just sort of honor you all and honor the presence and this opportunity that we have today. And so if you'll just entertain me for a moment, if you're sitting in a chair, make sure that your body's in a relatively comfortable and stable position. If you'd like to close your eyes and turn your attention a little bit inward, I'd like to invite that. If not, you can certainly keep your eyes open, maybe looking at nothing in particular. And I want to invite us to check in with ourselves, check in with our moment-to-moment experience. And there's many ways of doing that, of course, but mindfulness of the breath is a great kind of direct route to that in my personal and professional experience. So if you could just, with your eyes closed or open in a comfortable, stable position, simply turn your attention to your breath and notice the way that it feels. And in particular, it can be helpful to pay attention to the place where the nostrils meet the upper lip, the doorway to the breath. And now this breath has been going since the minute you were born, and it will go until the last moments of your life. And in between, it reflects, it contains so much of the information and vibration of who we are, the life we're living. So let's just spend a few moments being aware of how that breath feels. You might feel a sense of coolness with the in-breath. There might be a warm sensation on the out-breath. And instead of thinking about the breath, instead of talking to yourself about the breath, allow yourself just to experience it on its own terms. And instead of trying to change the breath, there's a lot of ways that we could change the breath, but I'd like to invite you just to feel how the breath is in its natural state without any attempts to change it, to make it better or to make it worse or anything like that. Just simply feeling the breath in the present moment. And then you can shift your attention again back to the whole of your breath. If you're just paying attention to it here, allow yourself to experience your whole breath and your whole body coming in contact with your presence. Your presence is in the present moment. And that presence is truly a gift. It's like a present. And so if your eyes are closed, making sure your eyes are open, and if your body is still, stirring your body a little bit and transitioning to the rest of our session together. I want to I want to acknowledge your presence. And I realize that a lot of us are going through a lot of challenging times these days, in so many ways. Of course, the journey through cancer is usually difficult. And then there's the pandemic and all of the disruptions. Hopefully we're seeing the light coming out of that into a new reality. I want to acknowledge the indigenous peoples of this land and all of their connection and the way that they've influenced us and gifted us to be present here. And maybe it's helpful to prompt you all to think about what you want to acknowledge at this stage of your health journey. We're in a transition. I know many of you are in a transition, and one of the things that I really want us to focus on today is what's really important to each of us and all of us, because I think focusing on what's important is important. Focusing on what's important really matters, and sometimes that's the best that we can do, and is just to figure out what's important and to focus on that. So here's my agenda and our larger talk agenda in brief. I'm going to talk a little bit about what is integrative medicine in terms of definitions. And then I'd like to, again, come back to this issue of what's most important in your health through a contemplative exercise with purpose. And I want to say a few words about integrative oncology, which is basically how we apply integrative medicine to oncology. And then I'm going to pass the torch to Dr. Shelhav and David Lang. I also want to make sure that we all want to make sure we have enough time for question and answers at the end. That usually is a really important part of this talk. So if you have questions, jot them down. We have a Q&A functionality that maybe you've used earlier during this retreat. I'll say for me, if questions come up along the way, I would invite them, and it's best to address the topics when they come up, but we'll also have quite a bit of time at the end for those questions if you want to save them. So what is integrative medicine? Integrative medicine means a lot of different things to different people, and honestly, it's not always easy to define, but there is a consensus definition. For those of us who aren't so involved in medicine or the scientific method, I want to point out that science works so well in part because it develops consensus. 1 + 1 is always 2 because it's true for everyone. And even though some of us may disagree that 1 + 1 is 2, we can have a meaningful conversation about 1 + 1 = 2, since we all agree about it. And since many, or if not most of us agree about it, even though not all of us might agree about that. Anyway, integrative medicine is like that. There is a consensus definition has more meaning than individual differences of opinion. And so the heart of integrative medicine is really that it reaffirms relationship, focuses on the whole person, is informed by evidence. And by that we mean both scientific evidence and other ways of knowing. Integrative medicine uses all appropriate approaches towards optimal health and healing. So, in a nutshell, this is a kind of a unique approach to medicine that can be applied in really any specialty or to any health issue and topic. I think many of us think that this is just what good medicine should be, that it should be focused on relationship, it should be holistic, it should be informed by the best of evidence and so forth. And until that's, universally true, or until we sort of have broader agreement, we have to have this separate basket of integrative medicine. But the good news is that, integrative medicine is flourishing and growing. And this is a definition used by our academic consortium of medical schools across the country, who kind of reaffirm the importance of this important kind of movement and approach to medicine. I think this is a great picture of what we're trying to do and how we understand health in the world of integrative medicine. And this is taken from the VA Whole Health Program. The link is at the bottom of this slide, but if you want to Google search if you want to come back to this, if you like what you see, the VA Whole Health Circle of Health is what this is. And basically, it's a way of kind of diagramming each of our health. And in the light blue rim around the edge is community. These are actually like really important things that determine health. Some of you may have heard, but it turns out the zip code that we grow up in is one of the strongest things that determines our health, according to many experts. And that's like really kind of mind-blowing, actually, because what's going on in our community, what's going on in society, decisions up at the Roundhouse and in Washington, how we're treating each other, all of those things greatly affect our health. Now, in the context of formal medicine, it's hard for us to address all of those things. So instead, we really kind of have to focus on our life as an individual. And so in the heart of this circle, in the dark blue, are things that we do to you in medicine or in complementary care. It could be drugs, it could be surgery, it could be acupuncture, it could be massage. All of those things are closer to the center of getting at the center of our health, but even closer to the heart of the life that we're living is the life that we're living. And so in terms of what I can affect in my health, it boils down to things like how I exercise. So at the top here, I don't know if you can see my mouse, but at the top of this circle is working your body. So that's physical activity. At the bottom is rest. How we work our body or don't work our body, how we rest or don't rest. It's a great, huge determinant of our health. And likewise, the food that we eat, the power of our mind, how the thoughts that we're thinking, our environment, relationships, our spirituality, and our sort of sense of development. We could debate, or we could talk about the other options, other parts of this wheel of health, other spokes on this wheel of health. But at the end of the day, there's a core set of issues in the life that we're living that can really make or break our health. And that's true whether or not we have a really serious illness like cancer. But often when we're faced with something like cancer, we're faced with navigating these things. If I'm taking chemo, what's the right nutrition? How do I get it? And how do I manage this new experience of food? That can become I'm sure some of you are experiencing these sorts of things. You never know which of these spokes might show up on your health journey as being uppermost or most important. But at the heart of all of that is this, I kind of think of the center of this wheel as who we are. We're not the society we live in. We're not the things that people do to us or how people see us. We're certainly not our appearances. We're not even, the life that we're living. I'm not my habits, right? I'm not merely the food that I eat or, whether or not I exercise or not. but in between all of that, in the middle of all of that, is something that resembles me, or something that resembles the core identity. And along with that are a core set of skills or propensities, a core set of kind of subtle orientations that this diagram talks about as mindful awareness of me, because that's kind of a route to understanding who we are and what's important to us, is being aware and being mindful. These words kind of capture what's going on deep inside. I'm sorry, this is a little bit of a zoom in for those of you who may not have been able to see some of the details, but there's a contour of what's going on in the middle of our life. And we find in integrative medicine that if we can get on the good side of that, if we can come in touch with the life that we're living and what's really important to us in that life, we have a much better chance of navigating the rest of this often challenging and painful, but also joyful and exquisite journey through life. And that brings us to these big three questions. These are three questions that have emerged in our field of integrative medicine. We're going to get a chance to ask ourselves those questions because I think they're really helpful. And I feel that in my own life, but I see almost every day with my patients, whenever I have a new patient, I do my best to ask them these big three questions to understand what's important to them, and what we might do about it, and how they want me to help. We don't always, when we go to help others, we don't always, it's not always obvious. And so making sure that we have a way of talking about that is a part of the intent of these questions. But for our purposes today, I want you to turn that around and think about, really asking them to yourself. And so actually, if you want to just take a brief mindful pause, again, kind of bring your attention back to your presence, to this life that you're living, that's sort of all enmeshed with this feeling sensation in the body and the breathing process that we're engaged in, whether we notice it or not. Every moment of our life, we're engaged in this breathing process. And I'm going to ask these three questions. I want you to sit with them for a little bit. And so the first question is, what do I need my health for? And we'll take a few minutes with this. If you have a pen and paper, you might want to jot a few insights down. If there's somebody you love in the room with you, you can engage this question for at least one of you, and then maybe come back to the other person later. Ask yourself, what do I need my health for? I should say it's okay not to know the answers, or your answers may change over time. This is not set in stone. When you have a sense of that, again, if you haven't written a few notes, just take a few notes to be able to come back to that. Using language is really helpful to kind of consolidate what's really kind of a big question, right? So the second question is, given what I really need my health for, what's the next step on my health journey today? A great journey begins with a single step. So what's the next step that I need to focus on today? Take some time with this question. And then again, I'm sorry that our time is brief, but if you want to come back to this, make sure you take a few notes or mental notes of what's your next step today. Next month, next year, later is not necessarily going to be helpful, but what's coming up today is something you can act on. Then the third question is, who or what do I need for support on this next step? This is particularly important in a medical setting, but we all need help, especially when it comes to healing and health. So what sources of support? It might not be a person, but for most of us, it's a person or people, maybe a professional. What sort of support do I need on this next step? You can take these questions as deeply or as lightly as you like. Again, they'll be here if you want to come back to them. But do give yourself time to use these or other questions, other means to focus on what's really important to you. And this is a picture of different means of coming in contact with what's important to each of us. This is from a website called contemplativemind.org. And this is a tree that depicts different approaches, different contemplative practices. And so you can see that there's a lot of different ways to know ourselves. There's a lot of different ways to come in contact with what's important to us. Again, I think, and there's a growing consensus in this field of integrative medicine that understanding what's important to you is like a really big deal. I mean, it's really big when it comes to health and healing. It's easy to get caught up in like the details of like, oh, should I do this treatment or that? Should I take this medicine? Should I not? Should I see this doctor or that some other provider? But all of that should really be informed and is made clear when we understand what's important to us. And so for some people that comes through meditation, like mindfulness, like we talked about. For others, it's movement, maybe dancing or contemplative running. Some people find a lot of support through the arts or journaling. For other people, it's clearly through prayer and that sort of divine dialogue. But there are many, many different ways, there are many different techniques and we don't have to commit to any one of them. We can use different techniques at different times. But again, I really most want to encourage you all to take some time every day to think about and to understand, to sit with what's truly important to you. Now, with integrative medicine, I can kind of just explain that briefly. When a lot of us think about it, we think about combining complementary or alternative approaches like herbs with conventional medicine, as symbolized by the stethoscope here. And that's a good enough understanding. And when we apply that to oncology care, here's a definition. There are leaders of this field of integrative oncology who have expertise both in oncology and applying an integrative method there. I'm not an oncologist, so if you end up seeing me or Dr. Shelhav or David, none of us are truly integrative oncologists, but we're here to kind of help support you on an integrative journey through cancer. And the folks at the UNM Cancer Center and the New Mexico Cancer Center, so many of those oncologists have an understanding that patients need to have some other parts to care that may not be just about drugs and surgery. So I want you all to kind of consider an integrative approach to your journey through cancer, even if we don't have any formal integrative oncologists locally that I'm aware of. Maybe that's probably changing. Here's a few principles. I won't bear you the details, but again, if you want to come back and think about how to approach your oncology care in an integrative perspective, the first and most important is first do no harm. And if I had to boil this down, I would say, focusing on complementarity. Sometimes it's easy to get into kind of conflicts with oneself and with one's care team when we're uncertain or when we're scared or when we've been through, some sort of trauma in the past. But this, being committed to the relationships and doing our best with communication, specifically if we're pursuing treatments or complementary approaches outside of our conventional oncology care, we really need to be talking to our oncologist about that and trying our best to keep everyone on the same page in our care team. And then here's my 3 takeaways. Integrative medicine is all about relationship. Talk to your oncologist about your usage of different complementary approaches, and then if you can involve a truly integrative provider, that's also really helpful. And there's good research to support that. There's some resources at the end of my slides too. I won't take time to go through the details, but if you're looking for comprehensive integrative medicine to support your health journey, there's great resources locally. There's great acupuncture practices in town. Oncology massage, we're going to hear from David Lang in more detail about that, and hear more about acupuncture from Dr. Shelhav here. Querendismo is a great local healing tradition that can be used very effectively and potently in combination with conventional oncology care. If everybody is in communication and we're sort of coordinating things appropriately. And there's even a great little video here from I think it's Sloan Kettering on integrative oncology. So thank you all so much. I'm going to pass the baton here to Dr. Shelhav, who's going to talk to us more about integrative medicine and acupuncture for oncology care, as well as traditional Chinese medicine.
Okay, thank you so much, Dr. Pierce. My name is Laura Shelhav. I'm a doctor of Oriental medicine. This is my 21st year in practice. And I'm working at the UNM Center for Life. So I want to review Chinese medicine with you, sort of give you an understanding through Western medicine eyes as to what it does, and also really the theoretic way that we use Chinese medicine through diagnosis. So I'll do a very brief history of Chinese medicine and a general overview of acupuncture and what it does according to Western medicine, what Chinese medicine looks at and how we diagnose and treat, some of the more common symptoms that I see in practice going through or after treatments, the safety and consensus for acupuncture, and where you can find a doctor of Oriental medicine. So just very briefly, about 3,000 years ago, writings were found in China on tortoise shells and bones, which were saying that people were already using Chinese medicine. And then to really push forward into the future, it sort of was introduced to the United States in 1971. When a reporter went following Nixon to China and got appendicitis, was admitted into the hospital, and where they used anesthesiology. Part of it was through acupuncture to do the procedure, and he wrote about it in this article, Now About My Operation in Peking. And that was our first introduction to acupuncture. And then when Nixon opened relations with China, became more and more common to use acupuncture as a part of healthcare. So to echo what Dr. Pierce was saying, traditional Chinese medicine really is in sync with integrative medicine philosophy as far as thinking of the body as a whole, to include your physical body, your mind, your emotions, the spirit, even your literal physical environment. If you're living in a cold environment, or if you're living in a warm environment, that also can be taken into consideration with diagnosis and evaluating the person. And what what that's about is that everything in Chinese medicine is about balance. So it's not about good or bad, it's about more balance. So you have more of something, then you have less of another thing. And so we kind of want to decrease the more and increase the deficient or the less. So, but as far as acupuncture defined in Western medicine terms, which is really what we're way more familiar with, and with the advent of all of these testing and studies that can be done now, really that's become why I think medical doctors and nurse practitioners and physicians assistants and nurses feel really comfortable, more so than ever, recommending acupuncture as at least something to maybe try. So just in sort of layman's Western terms, and I do have studies at the end of the slide that at the end of the presentation that would be really easy to kind of print out and give to your MD or to read on your own, these studies, but it helps the body release its own natural occurring painkillers. So like your natural feel-good chemicals like endorphins. So when you exercise, when you eat chocolate, these sorts of things are released to make you feel better. It relaxes the nervous system, improves circulation, and many acupuncture points are located where there are nerves and mast cells. So you can also improve immunity and lymphatic system circulation by using acupuncture. So there's sort of three branches of Chinese medicine. Acupuncture, which I'm talking about a lot and repeating, is actually just one of the modalities, but it's definitely the best known and the most commonly used. So I will talk a little bit more about that because most likely if you were to do something, especially going through treatment or post-treatment, that might be the thing you would use the most, would be acupuncture. Herbal medicine would be something that would be a little bit more complicated and would really necessitate a consultation with your oncologist and probably an integrative medicine physician. And food, of course, that's pretty neutral, and you work with nutritionists, and we can also give Chinese medicine recommendations. And then there's activity programs and exercise such as Tai Chi, Qigong, things like this. But the main thing I'll be discussing is acupuncture, since it's been sort of the best studied. And so just to give you a visual of what it's doing, it's moving qi. And I'm sure a lot of you have heard of qi. Basically qi runs through things called channels or meridians. And what is going on, or what the goal is through the acupuncture, is to move qi or energy through these channels, through these meridians. So we want to unblock blockages in qi, because when you have a blockage, then like behind the blockage, you're going to have sort of like a stagnation of movement. And then in front of the blockage, you're going to have more of a deficiency. And that's kind of where we get this unbalanced idea of, and I'll continue to visualize it. I just want to introduce you to the idea of traditional Chinese medicine is a system of energy medicine. It's like we have our cardiologists, we have our specialists in many different fields, but an acupuncturist or a doctor of Oriental medicine, they're specializing in this system of energy. So again, so there's energy channels, pathways that are also, you might hear meridians. Some of these channels have 11 points on them. Some of them have 65 acupuncture points on them. You can visualize them as maybe a train going across country. So visualize one of these 14 channels or meridian as a big train right across the country. And along the ride, you're going to have several stops, right? Some stations are going to be smaller, not as dramatic, but then you'll hit like the Union Station, and that would be huge. So likewise, there are points on these meridians that are more potent, more powerful. And so even though there's about 400 or 500, not 500, but about 400 points on the body, really there's about 100 that are like, you get a lot of bang for your buck kind of thing. This is just a visual as to channels and meridians across the body. Okay, so again, if you're familiar with subway stations or train stations, that's kind of how I like to describe it. Now, each meridian has a certain, not exactly organ system, but they're named after organ systems. It doesn't mean that if you have a deficiency in one of these meridians that we would it's not exactly Western medicine organs. So if I'm treating a point on the lung meridian, it doesn't mean that physically there's anything going on with the lung. It's just that maybe I'm feeling that there's some deficiency or excess along that meridian. It's purely energetic, has nothing to do with your actual physical organs. For example, there's a gallbladder meridian. A lot of people have had their gallbladder taken out, but the energy of that meridian still exists. So just to review, there's a lot of points, there's a lot of channels that we work with as far as acupuncture, in order to balance out the body. So there's several ways that we diagnose. Uh-oh, don't know what I did there. Okay. I don't know what I did. I'm just going to keep it like this. This is one of the ways in which we diagnose. So we use the tongue and we use the pulses. And it's not like Western medicine pulse. If you have high blood pressure, I'll tell you have high blood pressure, but that's not what I'm looking for when I'm feeling your pulse. I'm feeling the different meridians or the different channels. It's a way for me to feel the energy of the body, to kind of look into the body through the pulses, to kind of see, oh, that pulse feels a little choppy. So I need to kind of smooth out the energy on that meridian, because the goal is that everything circulates smoothly and we can become very specific with it. The diagnosis, according to Chinese medicine, will kind of go along the way of nature cycles. And so this is just sort of some of the symptoms. Let's say you have pain that moves around the body. And I would say, okay, I have to get rid of wind, or we just use these ideas of nature to try to navigate the body. Because again, it's a medicine that's been practiced for thousands of years. So what was going on is that practitioners of Chinese medicine were looking at the cycles of nature and correlating it into how the body works. So if there's too much dry, if there's too much cold, and that's how they would dictate treatment. So again, just to sort of sum up the energy medicine, it's not about good or bad, anything like that. It's just about bringing things into balance. And so this would be just a visual on how that looks. So if you're having a deficiency, let's say you're really tired, why are you really tired? And then we would go from there and using special points to try to nourish the body and work that way for the fatigue. So it's just about maybe bringing things so that they're more nourished. Okay, so to get out of the more, to get into more of Western medicine consensus about traditional Chinese medicine and what it should be used for. These are some of the things that WHO has recommended that it's used for. Some of the symptoms that I see a lot in practice are these hot flashes, cancer-related fatigue, nausea and vomiting, pain, whether it be neuropathic pain or arthritic pain, whatever it may be. So when we get into Western, why it might work for hot flashes is because it can release endorphins and inhibit norepinephrine, which can be thought to help reduce the hot flashes. And cancer-related fatigue is very, very common. And often I can use a scale. It's not official by any means to see if things are, if it's mild fatigue, moderate fatigue, severe fatigue, and look at the symptoms that way, and then use specific points that have been indicated, especially for people who are going through treatment or are post-treatment. Nausea, vomiting, very common. And when you would want to possibly consider using Chinese medicine, acupuncture, this has been a really well studied, this point in particular, PC6. And there's a lot about acupressure, which would be what you would really use at home. There are many websites about it and what points would be most useful. This point is actually even used for travel. In Walgreens or something, they would have a motion sickness bracelet that you could just put on, and specifically at this point. So to find this point, you would just take your wrist crease and then 3 of your fingers between the tendons and just rub it for about 2 minutes until you kind of feel an achy sensation. You can do it on one or both wrists, see if it's helpful. And there's many other acupuncture points that can be helpful as far as acupressure as well. This would be a few others. There's one here between the eyebrows, which is really good for anxiety, stress. Again, you can just rub this in a circular motion. And then also sometimes it's not possible to do too much acupuncture on the body per se. So we can also do it on the ear. There's just points everywhere. And then of course, there's points on the legs, the arms, whatever it may be. So I realized that the theory of Chinese medicine can be a little esoteric. I mean, literally, I was sitting there in class for a year where the only thing that my professors basically told me was just memorize it. There's no excuse. I'm giving you a book like this and you need to memorize it. Like, okay. And I was much younger, so it was much easier to memorize it. And it was before kids. So it was even easier to memorize it. But about a year later, I had my aha moment, as Oprah would say, and I was like, okay, I finally get it. Everything's interconnected. So it's not like there's one part of you that's in charge of everything. It's just everything's interconnected. The body has an innate will to want to heal. And so let's say one thing is kind of the energy in one thing that I'm seeing is deficient. Okay, so I just have to nourish that deficiency. Once it clicked, but it took a good year for me. You guys might get it in this PowerPoint. That would be awesome, but I just want to introduce you to this idea. Okay, so now we're going to go on to acupuncture needles. They're really thin. They honestly, I'm really gentle. A lot of acupuncturists are very gentle. So our goal is not that you suffer and that you're in pain from this. It's actually that, we get endorphins released, that we relax muscle, we reduce pain, and that it's just a really nice, relaxing treatment for you. It's, there's nothing on the needles. They're one-time use. They're FDA approved. They're sterile. So if somebody is afraid of the needles, usually we'll do a pretty, gentle treatment. They're always gentle, but maybe with a few needles just to get them introduced. And a course of treatments about, I would say, once a week, preferably for about 6 treatments. And then we can reevaluate whether you're getting any relief. So these are for your medical professionals, these slides. So you don't have to recreate the wheel. If you want to go into your MD, talk to them, whoever is in charge of your treatment, and say, I'm interested in acupuncture. These are some of the studies that have been put out. I've literally used these slides for an echo presentation that I did about a couple years ago, which was really for medical professionals. And those are helpful studies for people to see, okay? And if you guys are into that, they're also here for you. As far as safety, very safe. The adverse effects are very low. The most common that I see is bruising. And if that happens, it's not super common, but it's one of the more common things. But ice, arnica, it'll go away like any bruise. Usually, so again, the FDA regulates the needles. A study in Great Britain showed only 43 minor adverse effects reported with over 34,000 studies. And it's used around the world, treated billions of people for thousands of years. And then also I want to tell you talk about who also endorses this type of medicine. So the AMA, American College of Physicians, American Academy of Family Physicians, American Pain Society, VA hospitals also have changed it so that it's mandatory that they offer acupuncture, whether it's in the hospital or whether it's outside of the hospital. But if you are a veteran, you should have access to acupuncture. So you want to talk to your physician about that. And then CMS just approved it for low back pain. So that's very interesting. So even if you don't have this private insurance that most of the time does cover it, Medicare will cover it for low back pain in most of the situations. And I'm just about to finish up. This kind of tells you a little bit about how you can find somebody in your area. You can go to the NCC AOM. You can also go to the State Board of Acupuncture and Oriental Medicine. And we have a lot of training, 2,500 hours. So I feel like we're well trained in this modality. And then if you have any questions, please just feel free to email me or call. This is the clinic number. But email is usually a really good way to get in touch with me. So thank you so much for your time. I appreciate it. And that's it. I will turn it over to David.
There we go. Good morning. Hi, everyone. My name is David Lang again. I'm going to bring this up to a big screen here. So good morning, everyone. I'm so excited. There's 38 people who are here today. There's a few questions that need to be answered. We're going to hold off until the end. My name is David Lang. I'm a licensed massage therapist here in New Mexico. I've been practicing for 30 years now, and I've been doing oncology care for at least 15 of those years. I am a nationally certified oncology massage therapist. That's a 300 extra hour program, so it's about 3 years long. And I'm going to give you a few viewpoints, but I'm going to also show you a few things that you can do, whether you're a care provider for someone who's thriving through cancer, or if you're going through the treatment process yourself. Dr. Pierce brought up presence. Presence is not just for yourself, it's for your provider. Your provider needs to be present with you, whether it's someone like myself who's working with you for an hour, or an acupuncturist like Dr. Shellhop, who's in and out of your treatment working with you, or someone like Dr. Pierce. If your oncologist isn't present with you, make them present with you. I hear this all the time, that my doctor or my therapist didn't spend too much time with me because they have 15 other people they need to see. Well, if that's the situation, slow them down. And then, because they're there for you. And I had a young lady come into my office not too long ago, and we were talking about how they were doing. And this person looked perfectly fine, but she had just finished her treatment protocol. And it really bothered her, because the fact that everybody goes, you're fine, you're ready to go. The reality is, it's okay not to be okay. And that means that if you're not feeling well, you make sure that that person who's trying to over encourage you to say, thank you for that encouragement, but I'm still a bit struggling, and you're okay not to be okay. So today what I'm going to do is give you a few viewpoints about the fatigue and immunosuppression as far as massage therapy is concerned. I'm going to show you some techniques. We're going to start with my big foot here. This is reflexology points. And I said to my wife yesterday, I said, this represents your foot. And she said, yeah, Dave, that's my foot on steroids. So this is a steroid foot right here. Reflexology is an old technique that has been modified to modern times, just like massage has been modified to modern times. Back in Mesopotamia, 10,000 years ago, we've actually seen petroglyphs where there is drawings, that's what a petroglyph is, obviously, of people giving massages to other people. So we know through those petroglyphs that massage or touch has been an ancient form of healing. I was in a PT clinic one time with the students at the University of New Mexico, and we were talking, I was presenting about integrative care, and someone said, well, my PT, we've done research, and they said they showed me six research papers, they were sham papers, about how ineffective acupuncture and massage are. And I looked at her and I said, that's interesting. I could probably show you 3,000 research papers that shows you how effective these supportive disciplines are. And I said, I don't think that these types of medicines would be disregarded if in fact there was 3,000 to 10,000 years of experience, and it still wouldn't be used by billions of people across the world if it was ineffective. So making that clear, we are a supportive team. We are an integrative team. We come together as a group to help support people who are fighting and thriving through cancer and other demographics of health difficulties. So today what I'd like to show you, because my nickname has always been the Poop Master at the University of New Mexico. I work with a lot of children in the cancer center. And so I have a poop emoji hat that my daughter-in-law got for me with a poop emoji cape. And not that I wear them all the time, but I do help you with your pooping. And I know that might be sounding funny to you, but I know that if in fact you are on all these different drugs and care chemicals that you are on, you do have a difficulty having a bowel movement. So what I'm going to show you today is through my pillow sock here, foot, how to do some reflexology points. And I know there's some questions about acupressure. Dr. Shellhub does do acupressure. Acupuncturists do acupressure, and massage therapists who are trained in oncology care do acupressure also. So let's go ahead and go through a few points here that would help you and your caretaker give you the correct care for you. So I'm going to show you on Bigfoot here. You can see all the different organs that are involved here. We're going to go directly to the large intestines and the small intestines. And you can see underneath the big pad of the foot, if you go underneath the big pad of the foot, you're not going to hurt anybody if you do this type of work. It does, especially if you start at the feet. So we start here and go all the way out to the outside and come down the side and go through the middle and work in the center here. So I've got some really great oil here. I get my oils at Banyan Botanicals, which is a locally farmed and grown oil company here in town. They get their herbs from all over the world and here in New Mexico. And they know exactly where their herbs are developed because they support these farms throughout the world. So the name of that is Banyan Botanical. This right here I'm using now is called Maha oil. It has 27 different herbs and spices in it. So we're going to take my wife's foot here and we're going to just nice and gentle. Now you have to understand when you're doing massage on a person, the massage therapist has to get an extensive report on you and a background on you, what type of care you're going through. And by doing that, they can actually devise a program for you where it's not going to be uncomfortable for you. So the rule of thumb is if your platelet counts are under 150, or that's 150,000, we have to be conscious of bruising you, and you do too. But the reason why is not so much of the bruising, but because we can actually we want to support your immune system. And if you do too deep of deep tissue work, which is contraindicated for people who are thriving through cancer and doing radiation and chemo. So we want to keep it in a nice light touch for comfort care and to support your system, not to bring it down because your system is compromised already. You don't need someone like me coming in there and doing a deep tissue athletic massage for you. You need someone like me to come in there and help support your system. So what we're going to do now that we have the oil on the foot, we're just going to go across, and it's not deep work, but on your foot, because there's so much padding here, you can go a little deeper. And then when you feel a little spot that goes, ooh, that's a little knot there, that's related to the abdominal system. So the GI system in the abdominal area. And we're going to go through that in a second. So what you want to do is go right underneath the big pad here. I hope you can see me. And we're going to go right across, and then we're going to go right down. Oh, there's a spot right there. So that's in the small intestine area. And then we're going to come back up into the ascending colon and go back around through the transverse colon and then back down to the descending colon. That's where the pupalupa comes out. So I work with children a lot, so I got to use these funny words. So we're coming back and then we go to the middle right there, and that's the small intestine. So we're actually getting some stimulation in the body right now. And then we work our way up. If you have lymphedema, that's a whole different story. I'm also a certified lymphatic drainage provider. And Dr. Pierce at the end will show you some names of different providers throughout Albuquerque. One of them is gone, right? She moved away. But you want to get people who are certified in oncology care or lymphatic care. But I want to make a point to you. If you're going to see your massage therapist now and you feel totally comfortable with them, stay with them. They're not going to hurt you. And if you think that they need to call me, you go ahead and give them their phone number, because a lot of times massage therapists who aren't certified, they get kind of worried about working with people who are thriving through cancer, and there's no reason for that. Okay, so we've worked the foot, we're going up the leg, and just a little bit. And what I'd like to show you now is how to actually work on the abdominal area. And I hope you can see, you're not going to see my hands on the actual structure itself, but I'm going to show you just the movement around it. That's okay. I'm going to get my oil here. So what we're going to do is we're going to start at the descending side, which is the left side of the body, because that's where it goes into the rectum and comes out. And we're going to stimulate this area. And you can do this on yourself too. It's not a big deal. Nice and easy. These oils also are like liquid medicine. It's not medicine, but it's sort of like liquid medicine. So we're going to come here and we're just going to stimulate nice and easy. Nice and easy. Really light pressure. No deep work at all. And we're going to go back and forth and we're just going to hold. And we're going to feel there should be some rumbling that starts happening. When that starts happening, that means that area is stimulated. And then we're going to go around to the right side, which is the ascending colon, and you're going to stimulate that area and you're going to start moving all of that poop out and all the way around right underneath the rib cage. That's where the transverse colon is at. This is a beautiful structure. Human beings are beautifully put together. And now we're going to go all the way across and all the way down. And we're just going to go rubbing across the umbilical area, your belly button there. And then we're going to come around and do this about maybe 5 or 6 times, nice and easy, like the flow of the ocean. The tide's coming back and forth. And there might be a point where you feel and go, oh, that's pretty tender right there. If you're at that point, what I'd like you to do, just hold your hand there and go a little bit deeper. And then all of a sudden, what will happen, probably within about 15 minutes, you'll start having a nice bowel movement. I know that might be funny to say, but that's the way it works. What can we say? Anyway, those are things that a massage therapist can do for you when you're thriving through cancer care. What we need to focus on is if someone, and some of you here who might have had mastectomies and have breast cancer, if you have that cording that goes on, it goes down into the arm, that's how we can help out. You know, I know physical therapists will work you and go through the whole program to help stretch that and give you stretches and exercises for that. A massage therapist who is accurately trained can help you with that also and work those areas, and not just work them, but to actually show you how you can take care of yourself or a family member or a healthcare provider that's working with you. They can actually come into most massage therapist clinics and learn from the massage therapist so they can help you also. So what I would like to also talk about is you and what you have to look for in someone who takes care of people like myself, what you need to know. Massage therapists most likely, and 99.9% of the time, will not hurt you. 40 years ago, we were told not to work with cancer patients because it was contraindicated. That is totally false. It's not true. Massage therapists can't spread cancer. We don't have that power, but you can get tremendous benefit working with us. And like I said, there are therapists in town. I want to give you a few names of people who are not in town, or a name, down in Las Cruces area, Cami Shaw. She's down there and she's been a teacher down there for 20 some years. And she knows therapists through Southern New Mexico and Silver and all over the place down there. Her phone number is, if you got a pen, write this down now. It's 1-575-312-0405. That's 575-312-0405. A lot of massage therapists, they will give you, if you're thriving through cancer, they will work with you as far as payments concerned. insurance companies do not pay for massage therapy at this time. If you are on New Mexico's MedFrag program or the MeVia program, which is the DD waiver, you can get care for what you're going through now. When you come to my clinic, what you will do is I'm not with the university anymore, so I'm on my own. If you come to my clinic, just call my phone number and that'll be on the screen for you. And we will discuss on how everything could be paid for. So I'm gonna leave you with that. And what we're going to do now is questions and answers. I hope I've been able to give you a few pointers here. So let's go back to the panel itself. We have about 15 minutes of questions and answers, and Dr. Pierce is going to read the questions for all of us, and I hope you have a bunch of questions. Thank you so much.
Thank you so much, David, and thank you so much, Dr. Shalhav, and thank you so much, participants, attendees, for your questions and your attention. We have answered a few questions on the Q&A tab, which I assume all attendees can also access, but I'm going to go ahead and read the ones that we've answered. Josh W. asked, is it possible for Dr. Pierce to share the contacts and slides from today? And I went ahead and copied and pasted them into the Q&A tab. And then I think Kathy or MJ put them in the chat on Zoom. And then, yeah, for those of you who maybe aren't familiar with Zoom, you can select those texts and then either right click or Command Shift C or Command Control C. There's ways of copying text from the Zoom window, just like you would other text, or you could just write them down. But and again, well, let me ask MJ or Kathy, are we going to be able to make our slides available on the website as we have in the past?
Yes, sir. Janet will put them up on the website in a couple of weeks, I think.
Excellent, excellent. So there's several ways of getting that list here. And then maybe when I'm done with this round of questions, I can show those slides again. There was a second question from Miranda J. Does Dr. Shalhav use acupressure? Actually, you know what? I'm going to go ahead and share my screen here again, and then you can just kind of, as it were, look over my shoulder at this text here. And then let me bring my, there we go. So I have a few kind of images of these resources, but I'm looking at this, oops. There we go. Q&A right here that Dr. Shalhav replied, hi, Miranda, I do acupressure in conjunction with acupuncture. Dr. Shalhav, do you want to say a few more words about difference between acupuncture and acupressure?
Sure. The acupressure it's good, but I wouldn't use it. It doesn't get as deep as the acupuncture, is my experience. So what I usually will do is do an acupuncture treatment and then go over some specific acupressure points according to the patient's diagnosis, things that might be beneficial to do between treatments. But it doesn't get quite as deep, I don't think, from my personal experience as the acupuncture, but it's definitely something that I would promote patients using at home once reviewed in the clinic, I would say.
Great. And I'm sorry, similarly, there was a question of what, I think it was articulated as, what is acupressure?
It's sort of when you just stimulate a specific acupuncture point. So when people have headaches, let's say this point on the hand is really good. It's called LI4, and you would just push on it for a few minutes. But then again, I like to really individualize this, because on a pregnant woman, I wouldn't really want her to do this point because it's really contraindicated in pregnancy. So that's why I kind of steer away from giving general point advice and really like to make it specific. But the PC6 one we discussed earlier there's no really contraindication, and it can be really helpful for nausea. Likewise, this for anxiety and stress, also pretty benign. But so it's a good form to do at home. It's but again, I don't think it goes as deep as the acupuncture does. So,
Great. Thanks, Dr. Shahab. There was another question for you, which you responded here. The question was, how costly is acupuncture treatments? And Dr. Shahab said, hi, Nancy, it varies. Health insurance commonly covers, so check with them initially for in-network providers, usually less out of pocket. And Medicare covers for low back pain, as Dr. Shahab mentioned in her presentation. Out-of-pocket visits can be generally between $60 to $125 per session. And community acupuncture usually varies between $15 to $40. So there's this kind of two types of formats of getting acupuncture. One is more kind of like standard, and that's an individualized room with sort of focused attention. And correct me if I'm wrong, Dr. Shahab, but those sessions are usually more like an hour.
Yes.
Yes. Can you say a little bit about the difference between that kind of standard format and the community acupuncture formats?
Yeah, absolutely. I've done both of them. So acupuncture individually is you and the provider in the room kind of going over it's more comprehensive in a way, because you really have more time. Group acupuncture, and it's just you have your own room. Group acupuncture, have 3 other people in the room with you. So you may have about 3 or 4 people in the room with you, and you're just getting, everybody's kind of, it's more focused as like, what's the chief complaint? Check pulse, and then put the needles in. But the really great thing about community acupuncture is that it's much more affordable. And so you really want to plan on doing a course of about 6 acupuncture treatments before you decide whether you want to continue or whether you want to rule it out. So in that case, it's very good, but it's not private per se.
Great. And, I'll just put in a plug that I've heard that in China these days, that the community acupuncture format is actually kind of like more similar to what most people get. Is that true, Dr. Shahab?
It's absolutely true. In
So
China, from what I was told, is that, you will actually, the doctor will walk into the room, check the tongue and pulse of the patient, and not even talk as they're trying to get rid of heat or trying to nourish qi. And they can really tell all that from just looking at the tongue and pulse and not doing a big questionnaire. So like we do, but, and then they just go around the room doing that for each patient, putting needles in, sitting there for a half an hour, the patient does, and taking them out. But yes, that is definitely true.
Excellent. Yeah. Thanks, Dr. Shahab. There's a number of questions about massage that I want to make sure we get some answers from David in our last 5 minutes or so here. But there's one question from Joe about how long the effects of acupuncture last, and I can speak to that a little bit from the scientific literature. That at least for some indications, if you get a course of acupuncture, the effects can last even at least a year after that course of treatment. And so, Dr. Shahab, I'm guessing that that the better answer is to say it varies from, maybe a very short-term effects in the context of, for example, battlefield acupuncture to potentially years. Does that sound reasonable to you, Dr. Shaw?
Yeah. Yes. Generally, the course is that, some people will have one treatment and they might notice a difference in their symptoms for a day or two. And then after the next treatment, the duration of time that they get relief from their symptoms increases to the point where we can just do maybe a treatment every 2 weeks, then every 3 weeks. I mean, the goal is to get you out of treatment. It's not for you to keep going. But I have some patients that come in, I've seen for migraines, they're starting to have them again. So I haven't seen them in a year. So they come in and then, we might do 1 or 2 treatments. And then again, I won't see them for if ever again or longer. But yes, you can do it and be done with it.
Great. So switching a little bit to questions about massage, Nancy W. asked, why are massage therapists so rough? What was I see that you're started to type an answer there, David, but can you kind of share with the group verbally what your response is there?
Yeah, I started typing because I want those questions to be answered, is that they shouldn't be rough. And in fact, I just taught a whole class yesterday to massage therapists for 8 hours. And that was the focus of, that's the way the therapist should be, is present. If they're present with you or present with another person, they should be focused on what your needs are. And if they're too rough, you need to tell that therapist, stop. That's too much for me. And it's okay. If that therapist doesn't listen to you, that might not be the right therapist for you. Yesterday, I got to work with a young lady who has done an international Reiki program. Reiki is a healing touch type of program. And they have this organization that is called reachingoutwithreiki.com. And that's very light touch. And it's very good for people who are thriving through cancer. So if your therapist is too rough on you, you need to go to another therapist. That bottom line.
Great. And I think that's been a kind of a theme from our presentations in the past that, yeah, it shouldn't hurt. It should feel good. There might be a little bit of a good pain at times. Some people kind of like that good ache with a more vigorous massage, but pain is an important signal of don't do that in many instances. In most instances. David, there's another question actually for both of you, asking about contacts for massage therapy and acupuncturists in the Santa Fe area.
The best one I can speak to about that is Emily Bruff, Dr. Bruff, who also works at the Center for Life. Her phone number is 1-505-795-8262. She is going to be there for probably until January, but she has connections throughout Santa Fe with massage therapists and with acupuncturists. So she would know. I'm going to say that again. Emily Bruff, Dr. Bruff, she's an acupuncturist. Her phone number is 505-795-8262. And she'd probably be more than happy to help you out.
Yes, I mean, I also am very familiar with Dr. Bruff. She's great. She's wonderful. She does massage and acupuncture. She'd be a great resource. Also, the New Mexico Board of Acupuncture and Oriental Medicine has a great directory as to practitioners in Santa Fe as well. The only one I'm specifically familiar with is Dr. Bruff, though. And you can also check your insurance and see which providers are in Santa Fe. Again, I want to express that you want to make it financially comfortable so that, that's not stressful as well.
Dr. Pierce, there's one here for what resources are available for bed-bound cancer patients. Great question. I also do palliative and hospice care. When you are bedbound, there are some therapists that will come to your house. Please just call me or email me, and I will give you those names with people who can help you through that.
Great. Great. Thanks, everyone. I think we've reached the end of our time. So thanks so much for allowing us to connect and share some of our knowledge and insights. And thank you, Dr. Shelhav and David, for your insights and knowledge sharing.
Thank you. Take care,
Yeah,
everyone.
thank
Hope
you.
to see you
Thank you.
someday.
Thank you.
Be well.
Bye-bye.
Bye.
Thanks to our panelists for spending their Sunday morning with us. We truly appreciate you being here this morning. Thank you so much.
Thank you.